suction, we tuck the patient. We might remove the old dressing with a clean glove before we go to do our trach care. All right. Sterile gloves, I'm going to take those out, put them aside. My sterile field, just like when you take your other, when you're doing catheters and things, right, you can hold the corner of it. Try not to hold anything too much, and let's just figure it out. It might stick, it might this, or that. You do your best. What side goes down?
Shiny.
Yep. Okay. And I need this tray to be empty because I need to put my fluids in for washing and rinsing, right? So you're going to open your sterile field, you're going to dump the contents of your kit on the field. Now in this tray, there are three, and I'm going to touch it, obviously you're not going to do this, okay? In this tray, there are 3 sections. This is the largest one here. What do you clean the trach in?
With the saline.
Saline and
the peroxide.
Right, so it's a 50-50. Check your bottles, you know, all the things we always say, okay? I'm just going to skip right to the nitty-gritty part. Sometimes you'll see people have pre-mixed it, like urine specimen cups, you'll see they have little measured cups that's already 50-50. Or you can do it yourself. You can use one of those cups to measure. But it's about half-half. The hydrogen peroxide kind of oxidizes and bubbles the secretions to help you get it off, is all that it really is. It just helps you a little bit. So I would use this as my cleansing one. I would use this as my rinsing of the trach. And I would use this as my little sterile water to clean, you know, use for my Q-tips and for cleaning. If you switch and do the opposite, it's okay. These are sterile areas. It's just a choice, and that's what I would do, okay?
So you would put saline on the other 2?
All 3 will have some, don't go over your sterile field. All, you know, bottle, lip, check. All 3 will have saline in them, okay? So saline, and then hydrogen peroxide I'm going to pour in here 50-50, okay?
Only that one then.
Because that's your cleansing one, and that's your rinsing. And I don't want to put hydrogen peroxide back in their throat, right? Think how that feel, might be irritating, be kind of caustic. Okay. So next I got to put my gloves on. And we're going to pretend to have more table space. Actually, you know what? Lady, I'm going to move you more. And how I tell you guys, you can touch the edges, you can move it to where it needs to be. We're going to pretend her little tucky thing's not there. Okay. Put your gloves on. Same thing like suctioning. Put yourself in the spot for best success where you're at best comfort, most comfort. Anybody left-handed? All right, so for you, I would have you sit on the other side of the bed. And I was telling them, take the time to do that for yourself. Because then you'll feel more comfortable. You'll just perform better. You'll do better.
Yeah, we're swell with the shots and all the other procedures too.
Yeah. All right. There's my gloves. You can get rid of this or not. I'm pretending to have the trash can by you, right? All right. So I am going to touch the inside of this. Put this close to me. I'm going to go get my tray. Again, you're talking to your patient. You're letting them know what you're doing. A couple things about trachs. The ones we have here, most of them are pinch and pull, like little alligator clips. I think in the procedure it talks about turning it 90 degrees and taking out. You'll know when you see it. I don't know if we have any of those in here or not. Whenever you have a patient with a trach, is there anything, any extra supplies, any equipment you should have in their room at their bedside at all times?
Tube and the obturator.
Yes.
Obturator.
Yes.
Smaller size.
So you would have, sometimes you have the same size and a half size smaller, or one size smaller. Why do you want a smaller one?
For in case it shrinks.
Why would it shrink? If there like something happens and it falls out, there's an airway issue and it's swelling, you might not be able to get the same size back in. You need trach. People who have had trachs for a long time, it might just be fine. You don't have to rush, but especially a new one, you want to get an airway right back in there. Okay. So in this particular circumstance, I'm going to pinch and pull. I'm going to put it right into my hydrogen peroxide one. Let it soak for a second. I'm going to get my handy-dandy brush here. I'm also going to separate out my clean dressing because I don't want to get it all wet and messy because I want to use my nice clean trach dressing. There you go. So I've got your Q-tips, you've got your gauze. So the trach's in here soaking. I'm going to, the inner cannula, I should say, swish it around a little bit. I'm going to scrub it like I'm doing the baby bottles at home. You know, clean the outside. We're all good. Then I'm going to rinse it. In here, get all the, you know, stuff that I loosened off. And then I'm going to just shake it a little bit. It's okay if a drop or two of the sealing goes in, because we're all, that's what we're made of, right? We're kind of salty water, right? But you don't want a lot, because think about when you choke and you cough when you're drinking something that goes down the wrong pipe. Doesn't feel so good, right? It can be kind of burning and irritating to your lungs. So shake out all the drops that you can. Put it back in. And now we're going to clean. Now we're just kind of cleaning house. That was my stomach. I didn't eat my sandwich yet. All right, so I'm going to use my Q-tip in the clean one, right? This was the cleaning it. That was the rinsing one. So I'm not going to touch these. These are dirty now, right? Because I got all the gucky stuff. And they will have gucky stuff. That's my medical term for it, right? Because, right, it's normal to have some secretions, right? They have some airway stuff going. And where do you clean? You clean where you need to. You clean around here. One time in my trash. Where's the Q-tip? You might want to clean underneath. I like to hold it when I'm manipulating, touching around, because you don't want that moving in your throat, right? You're going to look at the incision line. I'm going to kind of clean in my little circular motion like we do everything. Circular motion, that's great. If you need to, you have these. These can be for moistening and for drying. So I'm going to just wet this one a little bit, because she's got some secretions on it. I'm looking at the incision, it looks clean, but just kind of want to make sure she's all nice and tidy and clean and dry. And then I might use one of these to dry the area. What kind of environment does bacteria like the most?
Moist.
Warm, dark, moist environment. Well, what am I creating when I put that dressing back on, right? Yeah. So I might like to just kind of, not rub their skin, but kind of pat it dry a little bit. All right, we are looking good. Okay, now I want to talk to you about changing the ties. Usually you will not use these kind of ties anymore. You usually see these Velcro kinds, and I'll show you that in just 2 seconds. If you were to use these, say the person's neck is such that it doesn't fit any of the nice Velcro ones that we have, then you need to use this. Or maybe it's a tiny, tiny baby, they don't make one small enough, or whatever reason. What I was taught to do is you fold the end over, you snip with the scissors, and you glide it through once you go through. So I would have someone else with you. Number one, it's always good to have a friend here, maybe hold it steady if you struggle to do the next tie. Number two, my habit, my practice is I don't take the old one off until I put the new one on. So that way I have something securing it there. Because I am paranoid. It is not going to be on my watch that this falls out. And there's room for 2 ties anyway. So I'm going to slip the...
When do you change the straps?
A lot of times people, they used to say daily, but I think it's really as needed. If it's dirty, change it. If it looks good, leave it. Because the more you fuss with it, the more you're taking chances. So I would put the end through. I would put it through my little slit that I made, so it would make a little loop. And you're going to go behind. And I have done this. I have used these. They just have nicer ones now. Goes in, you come out through here. On the other side. And I believe you're not going to change ties when you guys come back. You're going to tell us you would change them if you needed to. And we might ask you how you would do it. And then you would tie it on the side. When you tie a knot, you don't tie it where they're going to lay on it. It's going to irritate their neck. How much space should I leave?
2 fingers.
2 fingers. Yep. So let me show you guys this Velcro one as well. Again, kind of hold your side. See, it's just Velcro. And again, I would put while I had the old one on, I would come in with my new one. Everything's clean and dry because I cleaned them really good. And I'm checking their skin integrity at the same time under this. Because that's a lot to have on you all the time, you know? So check and not only right here, but all around. Check that skin integrity. Put the new one on, looking good. Take the old one off. Maybe you need one more little wipe around. Here, so I have my new, nice, fancy, dancy Velcro one on. So now I'm going to take my old one off. Mr. Smith doesn't need that old, yucky one. If I made any mess whatsoever, I'm going to clean and dry, clean and dry. And what do I do last? I put my nice, new, clean dressing on. try really hard not to touch the dressing as much as possible. Just let it be the dressing and the patient. The less I touch, the better. Cleaner it is for them. Ta-da. What? What's your question? Ask me. I'm here
No,
for
I
you.
thought because you know how you going back and forth. Aren't you like contaminating the field or?
Field's done. I cleaned the trach. I put it back in. Field's done. Good question.
So it's only the trach then.
Mm-hmm.
Okay.
What else do I need to think? So think it through. What else do I need to be sterile for?
The insertion? No.
I already did it.
Okay,
I
you
washed
did
it and I put it back.
Putting it back in.
I washed and put it back first. I did
Okay.
them first.
Cleaning around.
And then I cleaned it around the sterile Q-tips and the sterile gauze and I cleaned it. Is this a sterile area?
No.
No, it's your airway. But you keep it